clock is 13. You've been working, but you're flirting with the weekend. You can freak out. 1 in a million. You're a gem shine when the light grows dim. Sing 1, 2, 3, 4, 3, 2, 1. Cause no one can do it like we do it, like we do it, like we do it. Cause no one can do it like we do it, like we do it, like we do it. Cause no one can do it like we do it, like we do it, like we do it. Cause no one can do it like we do it, like we do it, like we do it. We got the right stuff. We put the hammer right down. Wanna be like us? You better stick around. If you want it,
interesting music, Mr. Producer.
like we do it, like we do it.
Hey now. A lot of
Daily
enthusiasm.
dose of, oh, it's not your daily dose. It's your dose of Dr. Drew.
It's as daily as we can make it. Appreciate you being here. What up? A lot of enthusiasm for the music, Susan. Well done. Is there a name for that music?
It's called Full Like We Do It.
Of course, that's what it's called. Oh, Rex is on the move again.
We like doing it, that's for sure.
Catherine, are we not seeing the stream? Oh, we got Facebook going again, it seems like.
Yeah, it's working.
What kind of physician am I? I am an internist who, in addition to have a hospital and outpatient medical practice, spent about 30 years working in a psychiatric hospital and running addiction medicine and medical services there. So a lot of different
Hello,
things.
Houston.
What about
Oh,
Houston?
the music's still on, sorry.
Oh, yeah, thank you.
Oh, hi, Cindy Keza.
Cindy Case is on here?
One of my psychic mediums is here. My friends. She's my friend. She's not my psychic medium, but she's my friend who's a psychic medium.
Don't you have a show with her up somewhere?
Yes, we do. We have an episode with medium Cindy Keza and psychic Rebel Colby.
Fantastic. So here's the deal. I'm following the stream as you comment on Facebook and Twitter and wherever else you are on Periscope, whatnot. And if you have any questions, we're not taking calls today. We'll take calls on Sunday.
Yes, we will.
And when we will have George Papadopoulos and his wife.
Yes, we will.
Is there anybody else coming? We have another guest that day?
No.
That's it. And
It's plenty.
that is, yes, that is a lot. Huntington, West Virginia, hi. Susan, some feedback on your show last night. People like that.
Thank you. We had a lot of callers and a lot of views.
6-year-old with asthma. Oh, boy. Hang on a second. Tolerance to Ativan. Of course there's tolerance to Ativan. Do not take it with the Percocet. It is a dangerous combination. They are taking alcohol, 1 milligram in a while for alcohol addiction. No. You need, this person needs to get into a program and get somebody on board who really knows how to treat addiction. The asthma for the 6-year-old. I'm not a pediatrician, so I feel like I should not be commenting on that, except to say I have noticed a lot of people have great benefit with really watching the allergens in the environment. Again, the breed is a Australian Shepherd. Rex, come here. People want to see you. Over here. Come here. Over here.
I have a picture. Let me get it.
Get the picture up?
I know. I just have to find it.
He's lying down here. Oh, and making a lot of noise.
So here's Rex.
Okay. I can't see the picture.
Well, I know you can't, but they can. It's a previous shot of you while you were on the show.
Rex poking me in the face. Super Bowl picks. I think I'm going to pull for Kansas City. I think that's true. Rex is interestingly playing with the other dog right now.
Okay, Drew.
Yes, I'm here. Okay,
Focus.
stay on camera. I'm waiting for questions. Everybody.
Okay.
Will I ever do celebrity rehab again? I'd be willing to. It seems like the networks don't want to do this, but we would be willing to do that. So if somebody's interested in rebooting that, we certainly would be willing to do that. Again, this is a place you can put your questions, and I can see the scroll. Cured from HCV, hepatitis C. I think that's what you're talking about, right? Hep C. Do I still have to watch the liver for the rest of my life? This is an interesting question. Yeah, you probably should be followed to some degree because it does leave behind some damage. And so, yes, you want to keep an eye on that. What are we going to do about the psychiatrist shortage, Angie? I have no idea. I'm really concerned about that. Shortage of beds and shortage of psychiatrists is a massive problem. So once we get this homeless thing under control and start to move people into treatment, that's going to be a major piece of solving the problem.
And then we had a nice talk with Mr. Marbot.
Oh yeah, we have a podcast. Is the podcast up yet?
It's up in on video form. It's on YouTube and Facebook and Periscope. It was the second of 2 shows last Sunday.
Okay, Robert Marbot is the so-called homeless czar. He's the guy that ran the treatment program in San Antonio,
I don't think
Texas.
I have a poster with him on it, but it will be on drdrew.com. So if you go there to drdrew.tv, you can find the links and just find it there.
Tanya, I'm not sure I get your question. Any advice for prescribers going into practice with your experience? Meaning what particular? I'm not quite sure what that means. When will doctors pay attention to objective medical evidence such as the DNA testing for things like cytochrome P450? Good question. It's not as standard as it should be, and I completely agree. It's a way of testing for metabolism of antidepressants and things before you go trying things. You see how people are going to metabolize them. I think that's a good, it's not, primary care doctors aren't trained to do that, and so it's not something that's going to be widespread until they are.
I just really liked what Robert Marbot said. He said that once it gets going, you're going to see a difference.
Yes, and that was, he said that, because I was giving him grief about it not being
the homeless czar. We don't call it a czar anymore. But
I was giving grief for not having a big enough impact. He said, look, if we can get 40% off the street, it will start to build on itself.
It would be awesome.
I know.
We have 100,000 in LA. It's terrible.
Is there any side effect of being on warfarin for a long time? No, it's essentially a lifelong medication. And heparin does cause problems, but warfarin does not. And I've followed decades of patients for decades with that medication and no problem. People want to know a lot about the coronavirus. And what is NAD treatment good for?
Talk about the coronavirus.
Yeah, so the coronavirus, these are viruses that are around. Of course, all viruses mutate, and they mutate in order to survive, right? We develop immunity to it, and it tricks us by changing its molecular configuration so our immune system can't see it, so it can survive. And coronavirus in China, evidently, has mutated to where it's become quite contagious and is causing a serious syndrome in the lungs, sort of like an adult respiratory distress syndrome, where the lungs kind of fill with fluid. Think of the vaping lung syndrome. It's kind of like that in a way. People sort of got a good load of that. And this is now caused by a virus. I'm going to predict, I kind of have a feeling that this virus is much milder and much more prevalent than we knew. So containing it's going to be a real problem. China has begun quarantining cities and things. I don't think that's going to work.
Wow.
I believe people have been saying there's a few cases here in the U.S. I'm going to bet there are many cases here in the U.S. We don't test for it, so we have no way of really detecting it. But we wouldn't detect for somebody just having a bronchitis or an upper respiratory infection. I'm going to predict there's a bit of that around. Let's see. Okay, got lots of good questions.
Especially if you fly.
Mm-hmm.
You need to use Clorox wipes on the airplane.
Clorox, if you're trying to clean an environment that when you're traveling or when you're in your kitchen, you have to use a chloride-based Clorox.
Right.
Clorox.
I do it every time.
That's the only thing that kills the virus. All those other antibacterial do not clear virus.
Not just one. Take a couple of them and also give it to your neighbor and have them wipe everything down. But sometimes you'll sit next to somebody who's allergic to, whatever,
Chlorine.
and then they give you crap about it. Forget it.
Yeah.
Just do it anyways. They'll live. Promise. I had this woman sitting next to me on a plane, and she's like, I'm allergic to
chlorine.
Chemicals.
Just chemicals?
Or something.
Just
I don't know.
chemicals?
And she was like,
that's not true. But
of course I was flying to Denver. But and she was like, she was wearing her workout clothes. She was a young girl. She looked like she was in great shape. And then when the nuts came, she said, oh, I'm allergic to nuts.
Uh-oh.
And I was like, what are you not allergic to? Like, what the hell? And I was like, and I was afraid to move. Like, I was afraid that my nuts were going to kill her. And then my Clorox wipes were going to kill her. And it's always, interesting when somebody doesn't like you cleaning the bacteria out of a plane so that you don't get a virus.
I've got 100 questions there I got to get to.
Anyways.
Okay, Paul, as far as the neuropathy, electric bike is good because exercise will be good. Exercise, of course, isn't going to improve just about everything. But neuropathies are not easily manageable. It depends what the nature of the neuropathy is. Sort of if you're an older guy and it's just sort of standard neuropathic changes that come with aging, it doesn't get a lot worse. It can be kind of unpleasant, but it usually is rather mild. Attachment. Somebody wants to talk about attachment. Can you be a little more specific? Because Joshua, because attachment is an important. It's a complicated process. We could talk at length about it. I need to know sort of specific. It's the early bond we do with our parents, and there's 4 different categories of attachment. We have sort of avoidant, disorganized, secure attachments, and they determine our relationships the rest of our life to some degree or another.
And we talked to James Fallon about that and how psychopathy comes from not attaching to the mother and narcissism, right?
Say that again?
How if you don't have the early attachment, you can have personality disorder.
Yes, you can. That's true.
Like being a psychopath or having a narcissistic personality.
There's somebody asking about seizure medication. Those are very serious seizure medication. Do not make any changes without talking to your neurologist about that. Is she on an insulin pump? Who on an insulin pump? I don't see that part.
If he misses your question, ask again.
Yes, please.
So he doesn't have to scroll up.
I am scrolling all over the place. I'm sorry.
That's okay. You're tired, honey.
I am tired, I got to say. Chlorine pads smell terrible, Susan. I have multiple sclerosis and high-functioning autism.
I never get sick.
Are they both the same thing? No. Autism is a genetic phenomenon that affects your ability to sort of read social cues and that kind of thing. Multiple sclerosis is an immune disease where the immune system attacks the myelin sheaths in your neurons in your brain and spinal cord. And there are very good treatments for it these days, by the way. What are NAD infusions treatment good for? I'm hearing a lot about these NAD infusions. There's lots of anecdotes about it. I know people are using it for treating withdrawal syndromes, particularly for alcohol. It clearly is good for something. I just don't know yet exactly where it's going to go therapeutically. I take an oral version of it every day, nicotinamide riboside, because it has shown to reduce cell senescence, and it doesn't seem to be harmful, so I think it's probably a good thing. I take something called True Niagen, and it seems to be an okay thing.
High mental illness, living with mental
illness.
I haven't had a drink.
Is everyone a little narcissistic? Yes, there's such a thing as we're all narcissistic to begin with, and there's a healthy narcissism and primary narcissism that we all have a bit of. So yeah.
I didn't mean to say that. I really didn't.
What?
Mental illness.
Mental illness.
Living with mental illness said hi to me, and I called her mental illness by accident. Sorry, I didn't mean it.
Should we worry about the coronavirus? Yeah, we should worry about it from the standpoint of limiting contagion, so wash your hands and do all those good things and use chlorine-based cleaning pads. Brandon talked about NAD+, mentioned on Joe Rogan in regard to aging. Yeah, that's aging is one of the things it seems to improve with. Have I made up with Robert Paul Champagne? I hope so. I mean, Christina P. and I did a podcast yesterday that it should air, I think, next week.
No, it's probably a couple weeks away.
And we've talked a lot about him and our affection for him.
You'll have to go back and see him in New York.
I will. I want Tom Segura wants to take him out to dinner, and I'll be happy.
Really?
To go. Yes, sir.
When?
When he and I are both there at the same time sometime.
Oh, God. Oh my God. Oh.
So Phoenix, you saw me on Lewis Howe's School of Greatness. I know I was on that podcast, but I can't remember what I said. It was a long, long time ago. Please tell me if there's anything I can maybe follow up on. I always worry about things that are that old flying around. The Aaron Hernandez, that's School of Greatness.
Oh yeah.
Somebody's asking about the Aaron Hernandez documentary. We did a whole podcast on that.
Yes, we did.
Last week.
Gosh, I don't know if I have that sign up here.
Is it up?
Yeah, it's up. It's on all the platforms. It's James Fallon, and also there's a picture of Aaron Hernandez. Go to your whatever platform you're on. Just scroll down and look for the one with James Fallon. He's the pathology expert.
He's the neuroscientist. You're asking about side effects of Lexapro and what kind of doctor. Your general practitioner should, your internist should be able to answer questions, but ultimately it is the psychiatrist that should answer and if it's a difficult question.
Do you want to give a little synopsis of what he said so people will get excited about it? 'Cause it was a really good show.
What
It
he
had
said
really
was
good
he
ratings.
agreed with me that Aaron Hernandez, the way the documentary is set up, they're sort of build the case that him being kind of a closeted gay man somehow, and that there was going to be information coming forward, made him feel desperate, and that's what led to a suicide. Neither here nor I thought that was a good explanation for what happened. They also made a lot of the traumatic brain injury, the chronic traumatic encephalopathy. And there's no doubt that that contributed to what happened to Aaron Hernandez, but there is so many other things that went on with him. Physically abusive father, really emotionally abusive mother who made some horrible choices that had a profound impact on him. He was severely addicted to drugs. He was smoking K2 in prison, and K2 is associated with very impulsive behaviors, including things like suicide. So he just had a big mess going on neurologically. And essentially that's what James Fallon said. And he may have been a psychopath too. He may have actually had a genetic problem on top of that. So it's a personality disorder, there's maybe a genetic disorder, there's chronic traumatic encephalopathy, there's drug use, there's severe trauma. There just was everything under the sun going on. For some reason, my computer just completely crapped out on me.
Oh.
And turned off.
Is it not plugged in?
It is plugged in.
Uh-oh.
So I can't read your stuff right now.
Are you sure it's not plugged in?
It is
that it's on?
absolutely plugged in, and it was just on it. Just the whole thing went black. Let me just.
Also, you can find that episode at
There it is. I'm back.
drdrew.tv and look for the James Fallon. He's an older gentleman, and he's.
How dare you?
You'll notice it says it actually says Aaron Hernandez on it. So.
Yeah.
It was a good interview. I really like him. We could have gone longer, but the homeless czar showed up, so we had to do a show with him too.
Somebody wanted me to speak a little bit more about attachment. One of the ways to think about attachment is we come into the world and we have our genetic endowment, and that's what our potential is. And as things express, about 60% or so of ourselves is an emergent property of our genetic endowment. Then the environment does its thing with us. That's our family system, that's our culture, everything else, and trauma, whatnot. But between the genetics and the environment is attachment. If people can have a secure attachment, it improves their resiliency and their ability to regulate, so the environment does not have so much of an impact on the genetics. So that's another way of thinking about it.
You have a lot of people watching today.
Oh, good. We appreciate that.
Thank you, everybody, and thank you for the hearts. We love you on Periscope. I don't know what it's going to do for us, but I heard that's a good thing if we get hearts.
Yeah, UX Cutler, he blamed his mom for his behavior. His mom made some terrible choices and really had a bad impact on him, but I would not put this all at her feet.
You're
There was a lot going on there.
All the brain damage, you know.
The documentary made a lot of the brain damage and him being gay, but those were two of many, many, many serious problems he was dealing with.
And Dr. Fallon showed slides of how the brain is different in people who have had a lot of...
No, we talked about
and
psychopathy.
psychopaths too.
No, we didn't do the brain injury. We did psychopathy.
Really? That was
Yep.
psychopathy?
Sean, wait. Somebody's looking forward to looking at, Scott. Tom Green was great on After Dark.
Drew likes to argue with me.
No, I want to be accurate. I'm sorry. It's just the
Well,
case.
it was my take, okay? I'm just a layman over here.
I know, and I'm not faulting you for it. I just want to make sure we get it.
You just sound like the Bickersons.
Should adults with pre-diabetes be prescribed metformin? That's a really interesting question. And probably there's some data that suggests that metformin actually contributes positively to longevity, even if it's not prescribed to somebody with pre-diabetes. And more than anything, if you're pre-diabetic, really get the weight under control and the exercise going. And in the meantime, maybe take the metformin. It does not seem to have any downside effect other than lower your blood sugar. Okay, I'm trying to go through. Yes, K2, very dangerous. Andro-U.
K2, what is that?
It's the synthetic cannabis, and it's very dangerous. What are my thoughts on epigenetics?
Well, that's what Aaron Hernandez was maybe taking.
Yep, and
we thought maybe while he was in jail or something.
That's what the report was, and that may be the reason for the suicide. That in itself could give a reason for it.
Sorry
Epigenetics.
about the dog.
Digging in the back
Tell him
here.
to stop it.
Rex, come here. What are you doing? Come up here. Come on, come on, come on. Show everybody your face. Epigenetics, of course, are an extremely important process in terms of the expression of our genotype. I don't know what you have to say about epigenetics or specifically what you're interested in talking about. Whenever I think of epigenetics, I think of, oh shoot, what is the lead singer's name from Offspring? He did a really cool research on messenger RNAs out in the periphery of neurons. What is his name?
That went right over my head. I'm not an expert on Offspring.
Shoot, it's going to come to me. You guys are going to help me.
Any Offspring fans out there?
Lead singer. Oh, there it is.
Dexter
Dexter. Thank you, Dexter. Sorry, Dexter. That's really rude of me not to remember your name. It's crazy.
Yeah,
I've
old
known
age.
Dexter for years. I know. It's awful.
You might be a little hypoglycemic too.
Me? Time for dinner, you mean?
Yeah.
I'm reading as fast as I can. You guys are really, what are the most long-term serious effects of small daily doses of benzodiazepines, if fully sober otherwise? If you are an addict and trying to maintain sobriety, it will prevent that from happening. And eventually, the thing about benzodiazepines on a long term is the panic and the anxiety will come back. And when you try to get off the benzo, then it will get worse. So then what people do is they elevate the benzo dose, which puts them now on a cycle of increasing dose, more panic, more anxiety.
Somebody said, "Yay, Clorox! Show them the Clorox."
This is what you need.
I know.
to prevent
I wish
viruses.
they were our sponsor. Manifesting.
Aridoc. What about the pre-diabetic? I thought I answered that. ECT for treating depression. Why not? ECT is electric shock therapy, which is now a very reasonable treatment for people with dangerous depression. But why not try transcranial magnetic stimulation? It's kind of the same thing. It's using magnets to create electrical currents in our brain to discharge the
I'm gonna
chemicals.
have to put all the banners for all the shows we did on
I know.
drdrew.com. We did a whole This Life #YouLive episode, and it's still up on the front page of drdrew.com if you want to listen to it.
Mm-hmm.
That was a good one.
Thank you for that.
Right?
Yep, it was a good one.
I know. I have all these shows now about these topics. It's crazy. And
What
I
about
remember them.
MDMA coming back into therapy? I think that's excellent, and we did. This is Don't Die Wisconsin. Hi guys. MDMA. It's not necessarily for addicts necessarily, but we did a long conversation with a psychiatrist, psychoanalyst, who convinced me. Oh my goodness! Somebody just entered something 100 times. Psychoanalyst, psychiatrist, that MDMA and low-dose ketamine is very good for trauma therapy in the right hands. I mean, it has to be a very skilled therapist it's not just for using and then magically curing something. It doesn't work like that. It's in the setting of certain kinds of psychotherapeutic processes around trauma. One Flew Over the Cuckoo's Nest. I don't know why you put that down there, but that and many other cultural phenomenon really, well, it's a long story. I will just say that the excesses and the deterioration of psychiatric care in the 50s and 60s is what that's why we have homeless people. We have laws that overreacted to that. People saw One Flew Over the Cuckoo's Nest and they thought they were watching a documentary, full fiction, and we had laws put in place that are now result in our homeless population. We need to get back to a middle ground that's much, much saner.
Remind them what we're doing this weekend.
We're doing a live show at 3 o'clock Pacific time, very much like this, except it's with calls, and we will have George Papadopoulos with us, who is running for Congress,
And his wife.
and his wife,
Who was on the show before.
And you don't tell you when you watch the show, you tell me if she shouldn't be cast in a movie as a Russian spy. And so, because she was accused of being a Russian spy, even though she's a lawyer and the assistant of the president of the European Union, that narrative stuck. We have a problem. We have a real problem right now with narratives. People want narratives, and once they decide the narrative is a certain thing, they will not get off it, even when the facts show them clearly that it's just not the case. It's really weird. I've never seen anything like that in my lifetime, where
so cute.
Narratives become
She's
more
a
important than
swimwear model.
facts. Right.
Swimmer model lawyer. I love that.
Okay.
Right?
Yeah, it's great. I think it's fine. Here's the deal.
Well, she's also a swimwear designer, too.
Yeah.
We have to give her credit for that. She's not just a model. She has a whole line of swimwear.
Yep. Am I doing keto? I'm trying to. I'm doing more carnivore type stuff. All right, I think you and I need to go to dinner, Ms. Pinsky. Yes?
Speaking of food, thanks for making us hungry.
Yeah, talking about the keto. I think
What is that?
I've been screaming about the pain scale chart for years. Thank you for noticing that. How happy are you to be vindicated of the opioid company being charged on the authors behind the chart? Thank you, Will, for noticing that I've been way long ago talking about what I was screaming about was pain, the fifth vital sign, that every patient has to have a pain assessment before you even take their pulse, and that if they had any pain and you didn't treat it, you could go to prison. That was insane, and that's how we got the opiate epidemic. The drug companies were duplicitous in the whole thing. It was my profession that caused the whole thing. The drug companies just sort of went along with the storm. Now later, particularly the OxyContin manufacturers, when it was clear that there was a problem, that was when they started doubling down their marketing efforts, and that's where I hold them accountable. So it's much later in the epidemic. Okay, guys. Susan, we good here?
Somebody want to know where we're live streamed.
Where are we live streamed? The same places, I believe.
Facebook.com/Dr. Drew.
Okay.
Facebook.com Susan Saylor Pinsky. I decided to put it there. Periscope, Dr. Drew. YouTube/Dr. Drew. Twitch and Mixer. Dr.
We'll
Drew
be there.
TV.
3 o'clock on
Yeah, we're
Sunday.
here. All of Drew's platforms are simultaneously here, so we can see everybody's questions.
Angie, what's a quick definition for intrusive thoughts that are normal? People always tell me they are crazy when everyone has intrusive thoughts at some time. Yeah, everything is, we all have traits. Psychiatric illnesses are just excesses of traits that, well, essentially what we all have, except for some conditions where there's actual major structural changes in the brain. But things like OCD and anxiety and depression, and personality characteristics, these are all things in the human system. When they become unregulated or excessive, they can affect functioning, and then they're considered a psychiatric illness. But intrusive thoughts or weird thoughts or, not stepping on the line so you don't break your mother's back, all that kind of stuff, rituals, that's normal human condition. But when they become overwhelming and affect functioning and are distressing, that's when they are considered pathological. Curtail the bipolar diagnosis after childbirth common. A lot of mood disturbances are common after childbirth because there's massive biological changes in your hormonal systems that, of course, affect the brain. Okay, do we get that happy, happy song back?
So we get to see you all on Sunday, and you live.
All right, we'll see you then.
Let's see if I can turn this
Have a
back
good
on.
weekend. There's that music.
Dance, Drew. You like it, huh? It's my weekend song.
Move with the rhythm. Shake it up, stop when the clock hits 13. You've been working, but you're flirting with the weekend. You can freak out. 1 in a million. Your vagina shine when the light grows dim. Sing 1, 2, 3, 4, 3, 2, 1. 'Cause no one can do it like we do it, like we do it, like we do it. 'Cause no one can do it like we do it, like we do it, like we do it. 'Cause no one can do it like we do it, like we do it, like we do it.
This is the weirdest song ever.
Like we do it, like we do it,